name's Simon Gilbody. I'm a psychiatrist and population scientist. I'm based at the University of York, where I'm the director of the Mental Health and Addictions Research Group. Over a number of years, I've become increasingly interested and concerned by the profound health inequalities that are experienced by people who use mental health services. So, for example, people with schizophrenia experience very poor physical health, and we know that life expectancy can be quite substantially reduced. This is an important issue that hasn't to date been researched and has not been seen to be a priority by the NHS. And we would like to try and make a difference in that area. So we've assembled a team of people from a range of different disciplines, range of different backgrounds, and we're going to come at this from lots and lots of different perspectives. So, for example, we've got an amazing team works within the group who are interested in how we might utilise green space and the environment. We've got experts who are able to help us utilise the data that are collected on people in the NHS and in relation to the environment to think about how big data can answer some of the big questions about what the important drivers are of this health inequality for this population. We've got people who work within creativity and the arts who are going to help us think about how we can use those approaches to engage people in their own physical health and can use creative approaches to ensure that people are able to understand the nature of this problem and to think about how we might intervene. We've also got people who are experts in the use of digital technology in people who don't traditionally engage with digital approaches to health. So I've mentioned that this is one of the most profound health inequalities, and we're going to look at that through the lens of political and economic science as well. So we've enlisted the help of people who are experts in understanding the causes and the consequences of health inequality. So we're going to do lots of work in this network over the space of 4 years. We're going to commission some research and we're going to generate some new knowledge. And as we generate new knowledge, we're going to seek to how we can ensure that knowledge has impact. So we're going to see how we can mobilise knowledge such that policymakers and practitioners can use this research knowledge to the maximum benefit and to help reduce and close this gap. So we've got an ambitious programme of work over the next 4 years. We're going to support some and commission some new research in this area, but we'll also seek to grow our network so that at the end of 4 years we'll have a partnership that stretches the length and breadth of the United Kingdom and engages people with lived experience of severe mental ill health and their carers so that they can help us understand and design interventions that are going to have the maximum impact to reduce this health inequality, to close the gap for people with severe mental ill health.